Hey guys, Dr. Christy Ennis, physical therapist, certified strength and conditioning specialist, and nutritionist. And today we are going to go over how to get rid of your tight and sore hip flexors. Now, hip flexors literally do this, right? They bring that hip up closer to you. So biking, running, walking, sometimes standing, most definitely sitting, aggravate those muscles. They tighten them up, and all of us do all of those activities. So at some point in time, we're going to get tight hip flexors. Now, the hip flexor muscles also attach not just into the hip, but into the spine and into the knee. So very often, you can have back pain, hip pain, knee pain, even actually shoulder and neck pain that's truly coming because of those hip flexors. So there are three key components that we need to work on. Number one is getting blood flow going into those muscles and getting the fluid between the layers of muscle and tissue gliding a little better. Number two is mobility and flexibility of that joint and the muscles. And then number three is strengthening up the muscles that actually help support, specifically glutes, so our bums, and abdominal muscles. If those are weak, hip flexor muscles take on way more work than they should, and then get tighter, obviously, than they should too. So, very first thing we want to do, like I said, is get some blood flow going. I'm going to use the Derma Edge, which is actually a device that I made and patented. I used to have people use a door hinge. So if you happen to have a door hinge at home, you can use that. But the reason I made this is because that didn't end up being overly comfortable to use. And I'll link the site for that. So literally going here, so hip flexor muscles, remember I said, right, obviously hip, but they attach down into the knee and actually attach up where the belly button is over a little bit and then into the top of that hip. So I'm gonna start with this, just like I said, blood flow going. Then I'm gonna lie down because it's much easier to get into those areas. So straightening out the leg to start. And yes, you're up into the abdomen, I know, but that's where these muscles are, right? And notice I'm going right in to the top of what we call the iliac crest. It's one of those muscles is the iliacus. The psoas is the other one coming up here, and then they both combine right near that belly button to dive deep into the spine to make the iliopsoas. So a lot of times we have trigger points in there. People think about this, but not this. So I usually tell people, find your belly button, go over about 3 fingers, roughly. I'm going to use the edge of this. Make sure you haven't eaten when you do this, because that's not going to feel good. You got to go through those abdominals. So pressing down, and then I'm going to get a little heel slide in there. So now we're doing a little bit of pin and stretch to the muscle, or flossing that muscle. You're going to do that until you go, oh, hey, that doesn't feel so bad anymore. So it's not a specific number of repetitions. And then the same thing in that little iliacus muscle, kind of find the top of that hip, dig in a little bit. And this time we're actually going to take those legs and rotate side to side. Make sure that feels okay. If that one doesn't feel okay on the back or the hip, you can do little pelvic tilts too to do that same idea of flossing that muscle there. Okay, I'm going to come up slowly and carefully, of course. Again, make sure that you are working all the way down, and you can almost feel, I don't know if you can see it, but it's definitely a little bumpy in that direction. So I know that my quads, one of those muscles is a hip flexor muscle. Those are tight, so again, those are going to pull too. So once you've done some blood flow, some fluid movement in there, then you're going to go ahead and get a little bit of a stretch. Now, one of your muscles called the tensor fascia lata is not a main hip flexor muscle, but one of the actions it does is flex the hip. That is the little muscle that attaches into that IT band. So when you have IT band problems, hip flexors are a problem too. So to really get this stretched, if you need to be next to something to balance, you can. But you're going to take that front leg and actually cross it over a little bit. Do a little bit of a, I might need something to balance, do a little bit of a pelvic tilt, squeeze those glutes, and then come forward. So now we're stretching this and this little tiny fifth pocket muscle is what I call that one. 30 seconds, a minute, really, and you're doing it until you can kind of relax into it and feel things go, a little bit, okay? So that is my favorite. You can certainly do that standing. I just like it better in a kneeling position. Now from a strengthening standpoint, like I said, abs and glutes, I've got a bunch of videos on those, but I'm going to show you 2 of my favorites right now. So abdominal-wise, you want to make sure you're gently pulling that belly button in. Your spine is in a happy position.
We're gonna start with just a march. Notice my hips aren't shifting at all as I'm doing this. My back's not arching. If that's easy, then we're gonna go ahead and add in like a straight. So march, straighten the leg out again. Don't let anything else move. So we're focusing in on those deep abdominals. And then the last level would be that struggling bug. So alternating. You can even do it with a bent knee if that feels a little bit better. Remember, we're trying not to use the hip flexors. We want to use those abdominal muscles. And then lastly, to get the glutes, I'm going to come on over here. A bench, a chair, anything like that works. You're going to go, let those shoulders basically rest. You're going to drop those hips down and then let them come up. If you need to support your head, you can. You certainly can come even more forward depending on the size of what you've got to use for a bench. If this gets easy, you can go ahead and do a staggered stance. And then if that gets easy, a single leg. So you really want to make sure that you press right up there to get those glutes engaged. And this tends to be pretty gentle on the hip flexors. I'm going to come on down. So there you have it. Get blood flow going, get things loosened and mobile, and then get things strong so that you can stop aggravating that area. Thank you for tuning in today. Check out my website at drchristyennis.com to order your Derma Edge and to sign up for my newsletter. Thanks, guys.